Well, hello everyone. How you doing out there? So glad you're here with me on another week of Neuropathy Support Group and Podcast. My name is Chris, and I will be talking to you today about roughly the same thing I talked about last week, but I found some new information, so I wanted to pass it on to everybody before I got going here. This one's 14 causes of peripheral neuropathy. But the reason why I want to do this is because, like I said, I found some new information on neuropathy itself. Also, I'm going to talk about, does peripheral neuropathy get worse in the cold weather? And the reason why I want to touch on that is because we are coming into the winter months, and we got to look for relief and how we're going to protect our legs during this time, because I know the cold weather really affects my legs and makes them really hurt. Even if I'm wearing sweats, they're still in pain. So I got those two topics, and let's get going here. Peripheral neuropathy refers to a medical condition resulting from the damage to nerves transmitting messages to and from the brain, spinal cord, and the rest of the body. The nerves, popularly referred to as the peripheral nerves, make up a complex network connecting the rest of the body, which is the skin, muscles, and internal organs, to the central nervous system. The condition is known to cause numbness, weakness, pain, usually in the feet and hands of the patients. People suffering from peripheral neuropathy have always described the pain as burning, stabbing, or sometimes tingling. After peripheral neuropathy has developed, very few types of conditions can be totally cured. However, early diagnosis and treatment can help reduce the symptoms of the condition. In some cases, where the nerve cell is still alive, the nerve fibers can regenerate slowly. Treating the underlying cause of neuropathy is crucial to preventing future nerve damage. Here are 14 common causes of peripheral neuropathy. First one is diabetes, which I think a big majority of us deal with, and that's how I got mine. Statistics indicate that nearly 50% of diabetes patients eventually develop peripheral neuropathy. However, not every patient of diabetes that develops neuropathy suffers pain as a result of the condition. High blood sugar levels damage nerves in the patient's extremities and also in other parts of the body. As a result, the patient may not sense pain, heat, or cold in the feet and hands. This means that you can never feel a deep cut or sore on your foot, which is why patients are advised to constantly inspect their feet always. Even though a patient can develop foot ulcers without knowing, especially if the shoe does not fit properly. The consequence of peripheral neuropathy can be fatal, especially when the symptoms are not detected early. For instance, an infection resulting in blood sugar circulation poses the risk of the patient developing ulcers, which may lead to amputation or even death. Studies have established that individuals and diabetes can reduce their chances of developing neuropathy by keeping their blood sugar levels close to normal. Number 2, the side effect of certain medications. Peripheral neuropathy often develops as a side effect of certain medications, mostly those used in cancer or chemotherapy and HIV/AIDS treatments. For some cancer and HIV/AIDS patients, the medication can result in nerve damage. When the nerves are compromised, the patient loses sensation and movement in some parts of the body, especially hands and feet. Although the condition is uncomfortable and even painful in some cases, it is important to note that it is rarely life-threatening. The good news about neuropathy developing as side effects to certain medications is that it always fades if the drugs are changed or when the treatment is discontinued. The patient may begin feeling better in a few weeks or months, depending on the severity of their condition in the first place. However, in some rare cases, the damage to the nerves may be permanent. Anti-alcohol drugs, anticonvulsants, are among the medication that may cause peripheral neuropathy. Number 3, hereditary neuropathies. Hereditary neuropathies refer to a group of inherited medical disorders that affect the peripheral nerves. As the name suggests, the disorder is genetic and they are divided into 4 major categories: hereditary, motor, and sensory neuropathy, hereditary motor neuropathy, hereditary sensory and autonomic neuropathy, and hereditary sensory neuropathy. Wow, that's a lot there. The symptoms of hereditary neuropathies are different depending on the type of condition. Generally, the sensory symptoms may include numbness, pain in the affected areas of parts of your feet and hands, and tingling. The motor symptoms include weakness and loss of muscle bulk. The muscle loss is witnessed in the lower leg and muscles of the foot. Other types of inherited neuropathies are known to derail the autonomic nerves, leading to impaired sweating, intensity to pain, and postural hypotension, among others. All right, number 4, inflammatory infection. Inflammatory neuropathies refer to a heterogeneous cluster of the autoimmune conditions that target the peripheral nervous system. This condition affects individuals of all ages and is characterized by a burning sensation, tingling, and numbness in the affected region, particularly the legs and hands. Some patients reportedly experience muscle weakness, which is a common motor symptom. This condition is rare but is known to cause permanent disability in the majority of the affected patients. Inflammatory neuropathies can be classified as either acute or chronic. The acute form of inflammatory neuropathy reaches in nearly 8 weeks. Fortunately, researchers have made significant progress in deciphering the pathomechanisms of these disorders, hope to help in the development of novel diagnostics and therapeutic strategies going forward. Number 5, autoimmune diseases. Autoimmune diseases are conditions in which the body's defense mistakenly attacks healthy cells. The body's immune system is tasked to guard the body against pathogens like harmful bacteria and viruses. The symptom uses antibodies to fight the foreign invasion and keep the body healthy. In a normal scenario, the antibodies can tell the difference between harmful foreign cells and the body's healthy cells. However, in the case of an autoimmune system or disease, the immune system cannot tell the difference and ends up attacking healthy cells. Some autoimmune diseases only affect one organ. In type 1 diabetes, for instance, the disease damages the pancreas, while in other cases like systemic lupus, the condition affects the whole body. In the event that the autoimmune diseases affect the nerves, a patient may suffer from neuropathy. Number 6, kidney disease. Chronic kidney failure, also referred to as renal failure or uremia, occurs when both kidneys fail to function optimally. The major roles of the kidney are to promote a healthy fluid balance and purify the blood. When these crucial organs fail, fluids and waste accumulate in the body, leading to several complications, including uremic neuropathy, a type of peripheral neuropathy that has been reported to affect 20 to 50% of patients with kidney disease. The imbalance of salts and other harmful chemicals in the body that should have been filtered in the kidney increases the chances of damaging the peripheral nerve, leading to uremic neuropathy. Patients of uremic neuropathy generally experience gradual numbness, muscle weakness, and insensitivity to touch, among other signs of peripheral neuropathy. The best way to deal with uremic neuropathy is to treat the underlying disease or diabetes. Patients are advised to adhere to a healthy diet, exercise regularly, and try as much as possible to keep their blood sugar level close to normal. Number 7. Exposure to toxic chemicals. Exposure to toxic chemicals and heavy metals is known to cause several complications to the human body. In many cases, some chemicals can lead to permanent organ damage, weakening of the immune system, contracting conditions such as allergies or asthma, or worse, reproductive complications and birth defects. Some people even develop cancer over long-term exposure to hazardous chemicals. Studies have revealed that toxic and poisonous chemicals can paralyze the peripheral nervous system, causing neuropathy. Exposure can happen through drug or chemical abuse or exposure to dangerous industrial chemicals at the workplace. Common chemicals that are known to cause neuropathy include mercury, lead, thallium, and arsenic. It also has been established that certain herbal medicines like the Chinese herbal medicines have mercury and arsenic in them that can potentially cause peripheral neuropathy. Ethanol, glycol, hexacarbonyl dioxides, among others, can also cause neuropathy. Number 8. Chronic alcoholism. Too much alcohol can cause severe damage to the central and peripheral nervous system, putting people with heavy drinking habits at a risk of developing alcoholic neuropathy. This condition is commonly characterized by pain and tingling of the limbs. The number of patients with alcoholic neuropathy is still unclear, although experts in the field speculate that nearly 66% of people with chronic alcoholism may have this form of neuropathy. Chronic alcoholism is often associated with both nutritional and vitamin issues, such as they're low or you might not have any at all. And those could be vitamins B6, B12, and E, folate, and niacin are essential in the proper functioning of the nervous system. Too much alcohol messes with the balance of these essentials, causing damage to the nerves, hence alcoholic neuropathy. Fortunately, this condition can be corrected by abstaining from booze and sticking to a healthy diet. Ditching alcohol will help reduce the symptoms of the condition and help stop further nerve damage. Number 9. Tumors. Any condition affecting the normal functioning of the nerves is likely to cause some kind of neuropathy. A tumor can be clinically described as a cancerous or non-cancerous rapid growth of abnormal cells on healthy tissue or organs. When tumors develop on the nerves or squeeze the nerves, affecting the transmission of signals to and from the brain, it can cause peripheral neuropathy. Cancer patients are most likely to develop neuropathy as a result of drugs used during chemotherapy, such as alkaloids and platinum compounds. Non-cancerous tumors are not entirely safe, either since they can grow too close to the nerve or on it, thus pressing it, causing stabbing pain and numbness on the limbs. Reportedly, patients with cancers of the nervous system, for instance brain tumors, skull-base tumors, and spine tumors, are more likely to develop peripheral neuropathy caused by damage on the nerves. Alright, number 10. Idiopathic neuropathy. A patient is said to suffer from neuropathy when damage to the nerve interferes with the normal functioning of the peripheral nervous system. Researchers have thus far established several causes of this condition, but unfortunately not all. When the cause of the peripheral neuropathy is undetermined, experts refer to this rare case as idiopathic neuropathy. Peripheral neuropathy can only be cured by treating the underlying condition. For instance, in the case where alcoholism causes alcoholic neuropathy, or when cancer treatment leads to the development of peripheral neuropathy, ditching alcohol and discontinuing chemotherapy, or rare stopping usage of certain drugs during chemotherapy helps reduce the symptoms of neuropathy. Yeah, but I'm thinking to myself, which one is more important? I think treating the underlying conditions first, like the cancer or anything else that has to do with that, I can see the difference. In alcoholism, yeah, I would stop that. But if these treatments for cancer are causing neuropathy, hopefully, by the time you're all done with your cancer treatments and you're in remission, you're going to be able to stop the neuropathic pain. The pain's probably not going to be there anymore. And neuropathy is common among individuals of 60 years and above. We're almost done there. We're on number 11, Carpal Tunnel Syndrome. Peripheral neuropathy commonly affects the patient's feet and hands. However, in the case of Carpal Tunnel Syndrome, the symptoms show in the hands only. In the carpal tunnel, a location at the base of the hand, a constricted place between bones and ligaments, runs the median nerve. This essential nerve is responsible for supplying muscles of the forearm and those of the thenar eminence, thus controlling the hand's movement. When the crucial nerve is squeezed, pressed, or inflamed at the wrist, an individual experiences a stabbing pain, numbness, and muscle weakness that affects and spreads along the arm. The symptoms become prominent on the fingers, particularly the index, thumb, and middle finger. Depending on the gravity of the pressure, the symptoms may intensify. That is, it becomes difficult for the patient to hold an object or make a firm fist. The pressure to the median nerve and tendons may result from other conditions like arthritis, trauma, thyroid disease, or physical injury to the wrist. And the last time I went to go have an EEG done, the electric shock, they found out at that time that I did have neuropathy also. So, of course, I went in starting to wear the hand gloves that you get that's supposed to help with carpal tunnel. Number 12, physical injury. Physical trauma is reportedly the most common cause of injury to the nerves. Injury may happen as a result of car accidents, fractures, or falls. Interesting, for instance, holding still in one position for too long is likely going to cause neuropathy. When the median nerve running through the wrist is damaged through physical injury, a person may experience carpal tunnel. The same case applies to injuries on other nerves transmitting information to and from your peripheral nervous system. Repeating a single activity such as typing or sitting in one position for way too long comes with the risk of neuropathy. When a nerve is damaged through physical injury, the patient will gradually experience numbness in the feet or hands. Sharp and rather throbbing pain will be felt in the limbs, and sometimes the victim experiences sensitivity to touch. Upon ordering a nerve conduction test, that's the one test I took, a doctor can determine if you have damaged a nerve through an injury. Since it causes severe damage resulting in pain, numbness, and loss of sensation in the patient's hands and legs. There are also other conditions that increase a person's risk to developing neuropathy like obesity, age, high blood pressure, among others. Obesity is often associated with muscle skeletal system disorders like acute back pains, osteoarthritis. Researchers have found that being overweight can impair neuropathic pain intensity and increase the nerve damage. Also, patients with high blood pressure are at risk of having their blood vessels rupture. This can also compromise the nerves traversing the area and in effect result in peripheral neuropathy. These symptoms of peripheral neuropathy happen to be similar depending on the type of nerve damage during the injury. This is regardless of the cause of damage, whether it is diabetes, physical trauma, or undetermined causes. All right, and number 14, not having enough B12 in your system is an essential nutrient you need. It's known to attract a series of temperamental conditions, among them neurological disorders. Stats indicate that the U.S. leads with the number of patients with vitamin shortage in their body. This is commonly, especially among the elderly, people over the age of 80. There are several established causes of vitamin B12, with a strict vegetarian diet leading to the list. The only established sources of B12 are animal-based diets that include red meat, poultry products, fish, and dairy products. Even having a mild B12 shortage in your body, in your blood, can cause significant nerve damage leading to neuropathy. I take B12 tablets. I used to get shots. I've talked about this before, but I just went straight off the counter B12, and that's been working great for me. Well, that's the end of this podcast episode for all of you. I hope you enjoy it. I hope you enjoy your time and your day and your time for the rest of this week. I'm glad I was able to get this one out sooner than what I usually do. I felt the need to get this episode out to kind of go along with the last episode, because I found more items on this episode that I'm giving you now that I didn't find on the other one. So I don't have enough time to get to the other we were going to talk about in regards to cold, how to avoid nerve pain during the cold. But I will talk about that the next episode, because we are coming into cold months now. And like myself, I bet you all have issues with your with the cold and causing a lot of pain in their nerves. So this will give me an opportunity to look up more information on that too. So I'll give you the full details in the next episode. I also want to let you know that I'm working on a live podcast to put on YouTube. Nothing's final yet, but if I do something like this, it's only going to start out for 2 episodes a month. But I will let you know when it's posted, so you can get an idea, and hopefully it'll bring us a lot closer, and you can share and show these to your friends out there, and hopefully we'll get some feedback from them also, and maybe they'll join our community on Facebook, Neuropathy Support Group and Podcast. But until then, have a great week, and all of you enjoy your time with your family. Goodbye.